This is Dr. Thomas Klein. I'm a specialist in painful and rare diseases. I have other interests as well. I'm a general practitioner, but that's my focus. It's been my focus for the past 2 years on helping patients who've been turned down by physicians, which is now a national problem. In the past 4 years, we have reduced the number of physicians prescribing pain medicines to only 20%. We just did a recent survey and asked our 30,000 patients, most of whom have long-term permanent pain issues, if they were receiving adequate treatment. Only 18% said they were. That's pretty bad. Nora Volkow, the head of the National Institutes of Drug Abuse, published a paper in the New England Journal which estimates about 10 million people in the United States are taking daily opiates. We did a survey and found out most of them have rare painful diseases with names like interstitial cystitis, adhesive arachnoiditis, CRPS, complex regional pain disease, etc., etc. So if you take 10 million people and 75% have been reduced, what's that come out to be? We are going to launch some what we call counts. The CDC was required in January, 4 months before they published their guidelines, by their board of scientific advisors to follow any unintended consequences. They did not do that. They don't believe that there are millions of people harmed by their regulations. And remember, these are not really regulations. It's what the government calls, there's two kinds of regulations. There's the kind that's passed by law, and then there are indirect regulations in which people just kind of say things, and then this kind of becomes law. We're having that problem in medicine where there is what's called standard of care. Now, in medicine, we have lots of problems and we have to treat each person individually. So sometimes a person will get brand X, sometimes they'll get brand Y, sometimes they'll get nothing. But when you have a standard of care made up by the board or a board reviewer, when medical boards hire reviewers, whatever they say becomes the standard of care, and then the doctor's prosecuted. So if the hired person who gets paid $7,000 or $8,000 to review charts says, well, the standard of care is to put a garlic bag around your neck, then that's what the medical board uses. And then they prosecute doctors and fine them or take their DEA licenses away or do other horrible sanctions, and they put it out in public for the rest of your life. So we have to be careful about setting standards with which to prosecute doctors. We have a profession that depends upon us being light on our feet and being able to tailor things. But that's not what's going on. And it's going to get into some other issues we're going to talk about later. But today's topic is filling prescriptions by pharmacists and distributors. And before we do that, I like to have a little session each time to kind of bring you up on the latest news and give you some cases. This is a typical case. May in this year, a single mom received a phone call from the family pharmacy in Lewisburg here in North Carolina saying they can no longer fill the prescriptions. I talked to the pharmacist, and what's happened is that the pharmacists are under so much pressure from the distributors that if they don't play ball, the distributors cut them off. So your wholesaler cuts you off from all your controlled substances, and this includes medicines for children with ADHD. This includes people with anxiety disorders and psychiatric disorders, in addition to pain. So the pharmacist basically made the decision that I have to think of my business. The problem is that the person involved was not given any way to fill their prescriptions, and so this became an abandonment issue. Abandonment means you no longer are treating a patient who has a serious disorder. If a doctor wants to discharge a patient, you send out a letter 30 days, you give them 30 days notice to find another doctor. But if I'm treating a patient that has a serious ongoing medical condition, the rules change. Abandonment becomes not finding another doctor for the patient to take care of their ongoing problem. Let's say a person has cancer and is right in the middle of radiation treatments, and I just send them a letter. Oh, you get 30 days. It's not the way it works. So anyway, this single mom, she's got an 8-year-old child who's kind of active, with his ADHD. And she is in crippling pain now with no medication. She was cut off without warning. She says, I'm having a difficult time caring for my son now that I have no medications. I can no longer talk due to the pain in my jaw because she had serious post-operative jaw pain. She can no longer go outside with my son like I used to because of my back pain and knee pain. I'm becoming more and more withdrawn, depressed. I no longer have an appetite. The thought of food makes me nauseated. I'm weak and riddled with pain. I'm having problems sleeping due to the pain. I can only get a couple hours sleep. These hours are interrupted with pain, constant crying, hurting, filled with anger that this can be allowed to happen. This is a patient that I know fairly well, and we're taking people like this out and we're abusing them. To take a person's vital medication away from them, no matter what, is patient abuse. People talk about drug abuse. This is patient abuse. Clear and simple. This is being done by the government that's frightening doctors and pharmacists and distributors into the belief that if you reduce the substance, you'll reduce the addiction. That's what everybody's afraid of. It's fear of addiction, phobia. But it's not true. We're going to have another talk about the limitations of opiate addiction because it's a genetic disorder. And we've been doing a lot of research on this in the past 3 years. And I can tell you that as a cautious scientist, I'm at nearly 100%. So, just a couple things. Okay, just checking the time here. I don't want to go too long. I'm going to try to keep this under 3 hours today. Okay, so let's go on to some other items of the day. Let me see if I can work the Zoom here. Yeah, there we go. Okay, this is from, there we go. This is from the CDC. This is one of their pages, and it's got some interesting things on it. One of them is up here. What's that say? Higher dose, higher risk. Well, we've had talks before about high dose, and the FDA, that's the controlling federal agency for all prescription drugs. Nobody else has that prerogative. CDC doesn't have that prerogative. CMS doesn't have that prerogative. If the FDA has the same articles that the CDC has that claim with higher doses there's a higher risk, I'm sure they would come to the conclusion, as we've come to the conclusion, these studies are not good. As a matter of fact, the FDA did review the studies in 2013, 3 years before the CDC regulations came out, and said, sorry, these are not scientific. So then they were taken over to the CDC anyway and published. So the CDC published things that are not true. Clearly not true because the FDA already ruled they were not true. And one of them is higher dose, higher risk. Then they go on to say the risk starts at 20 milligrams per day. 20 milligrams per day of oxycodone is the dose you give a cat. Patients prescribed, right, let's see where my hand is. There it is. Patients prescribed higher doses have higher risk of death. Now that's pretty scary. What do you think doctors think when they're told by a big federal agency that higher doses will cause your patient to die? Doctors don't want their patients to die. And then on top of it, the CDC, along with Roger Chow, C-H-O-U at the University of Oregon, made the claim that since there's no studies to show opiates work, they probably don't work. Here's our friend Socrates. Oops, I forgot to go back. There we go. I don't have my cameraman today because of this stupid epidemic. By the way, wash your hands all the time. Masks only help a little bit. Wash your hands constantly. If you've been around anything that somebody else touched, I just touched this. So if you go over and touch it, you wash your hands. I wash my hands ahead of time. Everybody washes their hands like mad. This is just a basic principle of infectious disease control. Anyway, we're now going to discuss filling of the prescriptions. Pharmacists are refusing to fill prescriptions. We have a paper that has 40 reasons, and we're going to turn that paper into a request for states to pass prescription fill bills. We've talked about this before, but we're having a hard time because we're a small group getting it off the ground. So that brings me to the next announcement. We, which is myself and others and other groups across the country, are forming the National Pain Council. It's an LLC. It's going to be an organization of citizens and professionals, and we're going to try to get together and do things like pass these laws. The distributors need a law refinement. They are under the gun from the DEA and the Department of Justice because under the law they're required to report suspicious orders. That makes sense. Problem is there's no definition of suspicious orders. What are they doing? They're just rationing drugs and giving out as little as possible so they won't end up with another multi-million-dollar fine. So that needs to be changed, and who's going to change it? Me by myself making these little shows? No. It's going to take tons of us. So we have started, there's a very rough little website that we've put together that you can sign up and volunteer for things that you're interested in. Like if you want to help get these laws passed, we need people that know how to talk to legislators. The website is www.nationalpaincouncil, that's COUNCIL.org. nationalpaincouncil.org. So the website is up, and we are trying to get it going. We've got a lot of material behind the scenes so that we can help out with these two issues. This distributor thing is really serious. Pharmacies are being reduced. Oh no, you can only have this much. And one pharmacist I talked to, they were actually the private company, AmerisourceBergen, sent in representatives to review their patients. This is a private company. Review their patients in the pharmacy? That's a violation of HIPAA privacy. You can't do that. because they want to give profiles to the pharmacist and say, see this profile has, look at these high doses, we're going to get into trouble, you can't do this. And if you don't follow our guidelines, we're going to cut you off. Okay, that's all for today. And I will be back with other topics. And check out the National Pain Council website. And keep in mind, it's brand new, and so it's under construction. Thank you.